So how do you know that this alternative anti-government theory that you're perpetuating wasn't started by the government to delegitimize the actual concerns?
Welcome to the Boom Clap podcast, where culture and conviction collide. I'm your host, Rita Rogers. Today, we have a good conversation for you. If you are watching on YouTube, you might notice that it's like a little bit darker in here now that I'm recording the intro after recording with Ellie today, because we got done recording and just continued talking. We had such a good conversation, and I don't know, I wish you guys could have been fly on the wall for the conversation afterwards, because I can tell you she has a lot of experience and she has a lot of interesting stories to tell. And we maybe will need to have her back on for another conversation about some of the other things she has done and experienced. But Ellie is an infectious disease scientist. She's going to tell us a lot today about her experiences, her research that she has done since. She has a powerful personal story and a passion for making science accessible. She has a Bachelors of Science in Cellular and Molecular Biology and a Master's in Infectious Disease and Microbiology. She spent years on the front lines of science, from developing vaccines for potential bioweapons during her graduate research and working in assay development and infectious disease research within the pharmaceutical industry. 4 years ago, she made the decision to step away from pharma and pursue a path that blends science, personal experience, public education. She'll tell us a little bit about that today. Also, Ellie was born with a left radial clubbed hand, congenital heart issues, and other challenges caused by a pharmaceutical product. And this experience has shaped her unique perspective on medicine. After undergoing countless surgeries, she deeply understands the life-saving value of Western medicine, but also recognizes that alternatives can have a place in care. She now dedicates herself to helping people understand complex scientific topics so they can make empowered, informed health decisions. She believes that her journey, both scientific and deeply personal, is no accident. Through all the challenges she has faced, she's seen the hand of Jesus guiding her path and believes God has kept her alive for a greater purpose. And she is a joy to talk to. This episode, the first probably 2/3 of it, we go through a lot of what we talk about in a kind of meticulous and slow manner, because this is a heavy topic. And I want to put the caveat in there that if you're listening with your children, this might be an episode you want to listen to first before you allow their ears to hear what's said here, because we do talk about abortion. We're talking about fetal cell lines. We're talking about embryonic cell lines, how those are obtained, how they are used. This is something that is widely talked about within the vaccine, or rather the vaccine world that is maybe opposed to vaccines, but we never go real deep. We never get below the surface and really seek to understand how this happens, or if it's still happening, all of those things. Then towards the end, we have a little more, jovial conversation and talk about the world as it is and the lack of critical thinking out there and just the two camp aspect of everything. And so, I don't know, I enjoyed this conversation. I hope that you guys can learn something from it and take away something that you can apply to your life. I want to thank Ellie for coming on. We'll get into the conversation with her in just a second, but I want to remind you first to please subscribe wherever you listen. If you listen on Spotify, Apple, YouTube, just hit subscribe. You can leave comments on Spotify. You can leave comments on YouTube. You can leave written reviews and 5-star reviews on Apple. We appreciate those. I have one person that keeps coming back with a negative review. Like every month, she leaves another negative review. And so I need you guys that listen and love this podcast to kind of outshine those 1-star reviews with your 5 stars. So that can be your Christmas gift to me, is just leave a good review. So anyway, let's get into the episode with Ellie. Hi, Ellie. Thank you so much for coming on with me today. This is a conversation I'm really excited to have. I listened to your episode with Alexandra from Just the Inserts, and I think that's not the first time I heard of you. I think I found you actually through comment sections on her page, and then maybe she kind of somehow connected us. I don't actually remember, but I enjoy your way of thinking through things. You're very logical. that is not the common theme these days on the internet. And so I appreciate it very much. And I would say this is a conversation I'm excited for and I'm relaxed to have. Like sometimes I get on the episodes to record and I'm a little bit like, oh, I don't know this person. And I don't really know you other than on the internet. But
Yep.
I feel like this is going to be a good conversation.
Same.
Hopefully with logical thinking patterns. So
Of course. Yeah, logical thinking patterns are definitely helpful in trying to remove that emotion as much as possible, especially when talking about scientific topics.
Yep.
Because emotion in science, things just get really muddy. So as much as possible, removing that emotion.
Yeah. Well, I mean, COVID's a really good example of that. Everything almost was driven by emotion on both sides. And I think both sides definitely were guilty of that. So It's a good example of things getting muddied and the truth being really hard to find. So, all right. So you're an infectious disease scientist. That's your quote title, I would say, right?
Yep. I haven't worked in pharma in 4 years, but yes.
Okay. So can you just tell people a little bit about what you do now and then what your background was and how you kind of got where you are now?
Sure. So I'm actually going to start with what I used to do because it'll make sense what I do now. So I have a bachelor's in cellular and molecular biology and a master's in infectious diseases and microbiology. And for my grad school work, I worked in a BSL-3 lab, there's 4 levels. The highest one's like Ebola. The one below it is anthrax. That's the level I worked in. So think spacesuits. But instead of being attached to the air hose in a ceiling, I wore a specific respirator around my waist. That's the biggest difference. And the biggest difference was that they said there was medications to treat stuff in level 3. There wasn't stuff for level 4. And I worked on vaccines and understanding specifically respiratory diseases in my grad school work. I then went on to work for a pharmaceutical company with developing tests on how well pharmaceutical drugs worked, and then in their infectious disease department. And then I worked briefly for a startup company when the world was super weird. They were trying to develop in-home tests. And when the world got weird and they were promoting hey, masks, no masks, all this other stuff, I'm like, this isn't making sense. This wasn't what I was taught in school. If you put a t-shirt over your face, it's not going to protect you from a bacteria, let alone a virus. And so things kind of started to unravel. Came across Alexandra's account. She was anonymous at the time. And I had prided myself that I was an educated person. I had done the research. I was fully pro-vax. Thought people like Jenny McCarthy were absolutely crazy. And I started reading inserts and I realized I was not educated. I was indoctrinated. And I walked away. And so now, one of the things I am grateful for I learned in school was how to take a complex scientific topic and break it down for the average person. So if I can't explain what a virus is to a 5-year-old, do I really know what a virus is? And I had test questions like that. So you couldn't just copy out of a textbook. And so now I use that loosely to explain topics to people.
Okay. So how do you do that, or where are you doing that, or how are you actually using that practically?
I've done it on some podcasts.
Okay.
I've done some of it on my page, more so in, like you said, comment sections and things like that. The back of Alexandra's book, Well Considered, the glossary, was written by me.
Okay.
Because I recognized she had topics in there that absolutely needed to be in there, but needed definitions that weren't, if you typed them into Google, you then have to look up 5 words within that definition. And I didn't want people to do that. I wanted the information easily accessible to people. So I wrote the glossary for her. And maybe spring of next year-ish, summer of next year, there'll be some other resources.
Very good. Okay. So to your original, I guess, job, what got you started and things. So why did you go into that first? And then exactly, can you just like give us a really specific example of something you were working on?
Sure. So I got into it because I was a medically complex baby and I didn't want to be a doctor. I'm an introvert. So I was like, being in a lab is perfect. I get to research stuff. Why do sometimes you need antibiotics? Why sometimes you don't? It was a great thing. Read The Hot Zone by Richard Preston. And I was like, yes, I want to be the person that goes to Africa and fights Ebola. I was very ambitious. And so that's kind of how I got started. And specifically in grad school, I worked with this thing called Francisella tularensis. That's the name of the bacteria. Tularemia is the disease. Rabbit fever is the common name. And one really interesting thing about it that they were studying it was you get a cut on your hand from it. You're typically fine. Maybe you need antibiotics. If you breathe it in, you definitely need antibiotics, and it could get worse. But if I had tularemia and I coughed on you, Rita, I couldn't make you sick with tularemia. And that just absolutely fascinated me.
That's one thing that got you started. Was that fascinating you?
Yeah.
Okay.
That's why I picked the lab that I worked in grad school. Like,
that's interesting.
Everyone else was doing like HIV stuff. And I'm like, HIV is boring. I want something a little more out there.
So you're like, it's interesting because it's unlike other things. And you wanted to understand why you couldn't get other people sick.
Yeah.
So what'd you come up with?
If I had stayed on and got my PhD, that would have been my doctoral thesis.
Mm-hmm.
I did not stay on and get my PhD. I only have my master's. But that is something that they've looked at for decades.
Really?
They don't understand why, with most other things, bacteria or virus, you cough on someone, you can get the other person sick. Tularemia, that's not how it works.
Yeah. I don't know. I just wondered if you figured out why yet.
I wish. That would have been my doctoral thesis.
So on your episode with Alexandra, that's one thing you did bring up was the tularemia, and it immediately like just intrigued me because I had messaged you afterwards. I'm like, one of my most memorable patients. I have so many memorable patients from the ICU days, but tularemia was one of the biggest. I had a patient and I just remember him coming in, and it was a weekend. I was in charge and he wasn't my patient, but I was helping in the room and we were going to intubate and everything. And I remember the patient's significant other stepping out for intubation and like, okay, well, I'll come back and see him in a little bit. And I'm like, I think really like you need to go say, talk to him or tell him you love him, because just in my heart of hearts, I knew I was like, this is really bad. Yeah. Like, this is probably the last opportunity you're going to have to speak to him. And we took care of him for weeks and it was horrible. And then I remember we couldn't figure out what it was at first. Like they just thought it was a flu. And I think like if he had been treated, I think gentamicin is the antibiotic. I'm not sure if I should have looked that up beforehand, but there's a specific antibiotic that is needed for that. And
I think it's doxy because I'm allergic to doxy. And then I remember asking, I'm allergic. So what do we do?
Yeah. So, but I just remember exactly where I was when one of my nurse friends called me and said, no, the patient passed away. And I'm just like, oh, like it was so heartbreaking. And then you think about like going to the woods and you're like, oh, like ticks can carry that, you just think about that. And I don't know, it was just really sad.
What state were you in when that happened?
Illinois.
So tularemia is more common out west. And so that doesn't surprise me that in Illinois it wasn't the first thing on people's mind. Mm-hmm. If you were out west, Arizona, Utah, things like that.
They actually really thought it was Legionnaires at first. That's what they thought. I can
see that because it gives like a pneumonia-like.
Yep. Yeah. But anyway, it was something that flagged me. I'm like, oh my gosh, like nobody ever talks about this. It was very interesting. But anyway, not to bore the audience here, like we're going to get into some stuff. But the first place I was going to go was like fetal cell lines, embryonic cell lines, all of that, because you're very good at describing why that's important and how that actually works. But I think since we're talking about viruses and bacteria and all of that, like there's a very prevalent camp online that's just like viruses aren't real ever since COVID. And I think part of it, and you can correct me if I'm wrong or tell me my theory might be off, but I think part of it is just people really did not buy everything during COVID. And the hospitals were kind of like not blowing things out of proportion because people were definitely sick.
Absolutely.
But the hospitals were not exactly being truthful. The government wasn't being truthful. So then just like kind of everything's a lie. And I'm like, well, if you're working on viruses in these, level 3 labs, like you said, what are you actually working on if viruses aren't real?
Yeah. So tularemia is bacteria. I mainly worked when I was in grad school with bacteria, but there were people working with viruses. And I have heard that claim. I definitely picked up on it shortly after COVID started. And I remember being very confused by it. And the main premise, specifically when it came to the idea that viruses weren't real, was so viruses are very, very small compared to bacteria. And there's also these things called exosomes that are in a cell that are always there. And so people were like, oh, it's just basically garbage material from a cell. Viruses aren't real. And because viruses can't be replicated without a host cell, that's kind of where that idea comes from. Whereas a bacteria can replicate on their own, the virus needs, whether it's human cell machinery, dogs, animals, whatever, to replicate. They cannot replicate on their own. They're in this gray area of alive and not alive. And I think to your point, people became so distrustful of the government and of science, and certain things were rushed that they're like, well, if they're making this up, surely it's not a stretch then to think that they're making up viruses in general. Or if they're exaggerating the effects of this, in their minds, it's not a leap that viruses don't exist at all. And I think there's a really big flaw in that thinking, but I agree that's kind of when it popped up.
Yeah. We had a very popular person on this podcast who thinks along those lines. Weston Price, Sally
Fallon?
Yes, Sally Morell. And she, I asked her the question. I wasn't trying to be like combative or anything. I just really wanted to understand because she says, you have to let people get measles. Like she'll say that, like you need to let people get measles because they're not having the proper immune response, to fight other things in the future if they don't get measles. But in the same breath says viruses aren't real. And I'm like, I just can't reconcile those things. Like it doesn't make sense to me. And so anyway, I'm very open to the thought process that we just don't fully understand how certain things work, or that viruses may act a little bit differently than we think, or, things like that. But I'm not open to the fact that we just have this terrain. So this is another thing. We were talking about this a little beforehand. Like there's terrain theory, there's germ theory. And I was telling my husband the other night, I'm like, okay, I always kind of said, I'm terrain, like I believe in terrain theory because to me that meant that the opposite of what almost all of my colleagues at the hospital meant, which was that you get sick if you come into contact with a virus or bacteria, period, which that is just simply not true. Some people have predisposed conditions, like pre-existing conditions that predispose them to being more ill, or they just don't take care of themselves properly, or they're smokers or whatever. Right. All of the way you take care of your body matters to how sick you get or if you get sick, but there's still got to be an insult. And so like there would be no illness at all if there wasn't an insult combined with the terrain, right? And so I always thought people just meant like the terrain matters. But then I learned like later, I'm like, okay, people actually think it's only terrain. And that makes literally no sense to me.
Yeah. So I'm in the same boat as you. I think how you take care of yourself absolutely matters. If you take two generally healthy-ish people, no pre-existing conditions, and one exercises regularly, tries to eat minimally processed foods, and another person doesn't really exercise a lot and lives off of fast food and processed foods, and they're both exposed to the same thing, my bet would be the person who takes care of their body could still get sick, but it's likely not going to be as severe. Mm-hmm. Is this true in every case? Absolutely not. But how you take care of your body matters, just like if you change the oil in your car regularly or not.
Yeah.
It matters.
For sure.
But it's not the sole factor, just like being exposed to something isn't the sole factor.
If you're on the hunt for the best non-toxic products to use in your home and on your family, look no further than Ro Casa Organics. They have products for your household, for body care, sleep, teas, hormone products, wellness products, allergies, skincare, you name it. It's a one-stop shop that is non-toxic and you can trust. You can use the code BOOMCLAP to save 20% on your first order. Ro Casa is on a mission to provide clean, non-toxic, high-quality, and completely natural, effective products. They're constantly pursuing the best ingredients found in nature, along with working alongside organic chemists and third-party testers to ensure maximum potency, efficacy, and quality with every ingredient in every product. If you haven't tried Ro Casa yet, go to rocasaorganics.com and use the code BOOMCLAP to save 20% on your first order. All right, so let's get into like the fetal cell lines and the embryonic cell lines and those two things and what they are and how they come about and all of that. I think this is so important. I think it's something a lot of people don't understand. I think it's something that, both sides throw around, but even the side that's opposed to the use doesn't fully understand. And you explain it really well. It's not pleasant, but you do explain it really well. And I think people need to be exposed to the topic.
Yeah, so whenever I explain this, I do give a little ears warning. So if your kiddos are listening, there will be scientifically accurate yet a graphic description of abortion. So if you don't want your littles to hear that, please fast forward or, turn it off. So there's two types of cell lines. There's fetal and embryonic, like you mentioned. Well, there's more, but in this case, we're talking about these two. Embryonic cell lines are typically from IVF babies. And what I mean by that is you go into an IVF clinic and they, let's say, take some eggs, take some sperm, and they create embryonic cell lines. And typically they're 5 days old or less. So at this point, they're called blastocytes. For some people, these are not humans. These are not babies. These are not fetuses. And scientifically, they do have a different name, embryonic cell lines. Oftentimes, these cell lines are discards. The parents, too many embryos were created and they don't want them. Sometimes it's the lab that's looking at them says, oh, there's a genetic abnormality, so you don't want to implant them. And that's a whole nother ethical discussion we can have. And so, but there's thousands of them. I cataloged them at one point.
Thousands of cell lines.
Thousands of embryonic cell lines, yes.
Yeah.
And the only way to get them is from IVF clinics. And these are very commonly used in drug and vaccine research. Doesn't mean it's in the product. That's not what I'm saying in this case. But it's used in things. It's used for research. But it's not always disclosed what cell lines, how they got them, whatever. So then there's fetal cell lines.
Just to ask a question really quick on that. Do parents who have participated in IVF have to consent to their embryos or their babies being used in this manner? Do you know? If you don't know, that's okay. I just thought maybe.
I don't know for sure. My assumption is it looks like a blanket statement that is very vague. I know every year there's a specific hospital where I have to see a yearly specialist, and they have you sign that like yearly waiver.
Mm-hmm.
And part of that waiver states, and this is not an IBS, this is for just a regular specialist, that any blood, tissue, or any other samples that they take can be used in research. So if I have to give blood because they want to check my vitamin levels or my white blood cell count, like pick a thing, they could then take the leftover blood, if I signed that consent form without altering it, and use my blood for whatever they wanted. My guess, I have not seen IVF consent forms.
No, that seems probably pretty accurate, that they're just using a blanket consent of like these discarded embryos could be used in research, and you're not necessarily privy to what that looks like.
Yes. A fantastic book that I read. It's not on fetal cell lines. It's on regular cell lines. It's called The Immortal Life of Henrietta Lacks. And it talks about how they established one of the most popular cell lines used today from a African-American woman that had cervical cancer. And then the family's realization and fight to get monetary compensation for this cell line, because the pharmaceutical companies have made billions, if not trillions of dollars.
Wow. I just got goosebumps. That's wow. I didn't really think of it that way. You know, they're using your tissue and making money off of it.
Yeah. Yeah.
Like they wouldn't be able to develop anything without it.
Correct. They're called HeLa cells, and they're one of the most commonly used cell lines. I highly recommend that book. It's not in an uber scientific way. It's definitely a down-to-earth read. Highly, highly recommend that book.
Okay, you were going into fetal cell lines before I interrupted. Sorry about that.
No, you're good. Okay, so fetal cell lines. This is the one that's hard for me. So fetal cell lines are made from fetuses in the womb, meaning from a couple weeks up to the research that I've seen. I think the oldest fetus or baby was 30 some weeks, well into a viability stage had they been allowed to live outside the womb. To establish these cell lines, the baby has to be born alive. There is literally no other way, because as soon as death happens, cardiac death, your body rapidly starts to decay. And so just like with organ donation, they keep you on ventilators and all these other machines to keep your body alive. Otherwise, why couldn't someone have a cardiac arrest at home, be transferred to the hospital, and use their kidney? So same thought process applies. So the baby is often born alive. They are not given any pain medication, and they take various organs from their skin to their eyes, to their lungs, to their kidneys, to their brain. Sorry.
It's okay. It's really disturbing. Highly disturbing.
It's very disturbing. I've seen cell lines from multiple parts of one baby. I've seen like upwards of 6 or 7 body parts from one fetus. There's a website called cellosaurus.org, which is where I found a lot of this information. It has all these different cell lines listed, and it'll tell you how old this baby was, what body part it comes from. And every vaccine is researched with, doesn't mean it contains it, researched with fetal cell lines. Some of them, because how they're made, contain parts of either the whole cell or DNA of fetal cell lines. This is not every vaccine. I am not saying that. Every vaccine has fetal DNA. Not what I'm saying. I'm saying all are researched with. And a lot of pharmaceuticals nowadays are also researched with.
Okay, so a couple questions. So
Sure.
when you say you've seen cell lines from like a single baby, multiple parts, you mean like in your research in a lab, like you would, there were cell lines that they were using? Or
So,
just like in your researching this, you've
so looking at
that.
some of the names now, because they're not like, I don't know, it's not like baby boy 42 lung. Like that's not what they're called. Yeah. They're called like, and I'm going to make one up, PCL 6495.
Mm-hmm.
And then PCL 6496. So I've worked with those cell lines, not knowing at the time what they were. That was on me because I didn't do my research. Fully own that. When I've looked online at databases, actually before I went on Alexandra's podcast, Well Considered, for some reason, I went down this rabbit hole and I spent, it was like a week. I had my screen projected onto my TV and I went through every single fetal and embryonic cell line on that website that I mentioned. And it wrecked me. And that's how I found out that some were from one baby, but multiple parts.
Okay. So what would you say? So first of all, when you say that they're not, the cell lines are used in research, a couple questions on that. And then I'll save my other question for a second because it's more logical to go in that order. When you say that the DNA or cells or any of that isn't present in vaccines, are you saying it's never present? Or are you saying it's a misnomer for people to say that there could be DNA present from fetal cells, embryonic cells, or, animal cells that are used? Because you hear, who wrote Dissolving Illusions? I can't think of her name right now. But
Suzanne Humphreys?
Yes. She's very concerned with cancer because of the kidney cell line used, the monkey kidney cell line used. And I think those are legitimate concerns. So with your knowledge and background of how this works, do you think that that is a illegitimate concern to think that there could be some leftover tissue or DNA from the way they're researched and the way they're developed?
Okay, so this is like a 4-part question. So if I don't answer all of that, remind me the parts that I missed. Okay, so that my general answer to all of that is all of this is an issue, but it can't be applied to vaccines as a whole. You have to look at each vaccine individually.
Yes.
Okay.
Makes sense.
There's a website called cogforlife.org. I don't know how up to date it is, but they do list the specific common cell lines that are used. And then they also have the vaccines specifically that contain fetal cell lines in there. So I pulled up this chart, for example. Let's take the chickenpox vaccine. If it's the Varivax or the Valerix, either by Merck or GSK, those both contain cell lines WI38 or MRC5. And I think, let me look it up. I think WI38 is a male. Nope, that's a female lung she was 12 weeks old in 1962. And MRC5 is a male fetal lung at 14 weeks from 1966. So one of the common things is, well, these cell lines are from so long ago, we can still keep using them.
That was my next question, because I hear that all the time. Like it's so long ago, and they're not. It's an evil that happened, and something good can come from it. That's an argument I hear.
That's between you and God. Everyone's going to have a different stance. I've personally spoken to my pastor about it. I encourage you to talk to your pastor, talk to God, and see where you stand on that. What I will say from a scientific point of view and from a logical is one of the arguments is, well, it doesn't matter because they were so long ago and no new cell lines are being created. And that's where I do have a logical scientific response, is that's incorrect. Because to your cancer point, if you define cancer in, a typical human, it is a cell that is growing rapidly without any checks and balances. Well, while fetal cells were designed to grow into all the different tissues and blood vessels and organs and just all the different things, right? They make them pluripotent, meaning they can turn into anything. That's how you need to grow a baby. That is how that works. But you don't want that. Like, I wouldn't want that right now. That would be the definition of cancer. So if you have a cell line from 1966 that has been continuously growing, it is inevitably going to start having more errors as it's continuously divided. If you think of scanning a book or a piece of paper, eventually that, whatever it is, millionth copy is going to be really faint and distorted.
Mm-hmm.
The equivalent of that is cancer in the human body. So the reason people are concerned about cancer, and in my opinion, rightfully so, is these cell lines have been used for so long. Rates of cancer have gone up. Am I saying the fetal cell lines in vaccines are the sole cause? Absolutely not. Many, many things in life have multiple causes.
Mm-hmm.
Am I saying it's a contributing factor? I think it's very plausible.
Okay. And so you are saying that the cell lines aren't all old. This is still happening.
Correct. The most recent one, the two most recent ones are, one was from 1985 and the 1995. The abortion was in 1985. It was thought in 95, called Percy 6. And then China in 2015 made headlines for Walvax 2, WALVAX-2. And that's in 2015. It has not, to my knowledge, been used in U.S. pharmaceutical vaccine development. I do not know if it has been used in any type of U.S. pharmaceutical research, because often there is sharing of research and resources across borders, regardless of political things at the time. So we could be in I'm going to make something up. We could be in a trade war with China, but that doesn't affect science.
That's interesting.
And so, well, technically, it is my understanding we're not supposed to be using things from recent abortions. We also know the U.S. has partnerships and labs in other countries. And this is where it becomes a very gray area that I cannot give you a yes or a no.
Mm-hmm. Yeah. Well, interesting. Like, just you've brought up organ donation a couple times, and we had interviewed Heidi Klessig from. She basically talks about the dangers of organ donation and informed consent within organ donation, and the black market that there is for that. And she brings up China because there are people traveling outside. It's like transplant tourism, essentially, like you're going to another country to get transplant, and it's very unethical. But one thing I just want to bring up too is it flags me also from that episode with Heidi, is just that you say, I think this is in the episode with Alexandra, you were talking about how this is the only way currently to research these products and develop these products, be it pharmaceuticals or vaccines, which are a form of pharmaceutical. And to that point, yes, it is the only way right now, just as organ donation is the only way to, trade out an old organ that's not functioning properly for a new organ that is. But anytime you have an answer or you have a certain way of doing things that's working, it really puts the kibosh or like kind of halts the search for any better way or any way that doesn't provide, or make someone to have, not speaking properly, cause someone else to incur harm,
Yeah.
And so that's really sad to me because we do have this way of doing things and it's problematic for multiple reasons. There's a risk for potential of cancer. There's concern for that. There's obvious harm to babies either currently or in the past. Like we don't, there's embryos that are out there that if you believe that life begins at conception, they're being used and they're not being allowed to have a life, And so we have this way of doing things that is causing harm.
Yep.
And is anybody else looking for a better way? Is there a lot of research going on? And if there is, it's probably fringe groups doing research. It's not like the pharmaceutical industry is going to spend money on a new way of doing things when they got this way that works.
Yeah. So a couple points to that. So I pulled up my, database that I had collected when I went through all these cell lines. And to be clear, while Walvax 2 was specifically made to replace the cell lines that are currently used for vaccines, that doesn't mean there hasn't been fetal cell lines from abortions created after 2015. There's been ones that I found as late as 2021, 2022. And the oldest fetus that I could find is 34 weeks.
Oh my goodness.
A baby can survive outside the womb at 34 weeks. Oh
yeah. Yes.
So to say that also the claim these are just, and I'm putting that in air quotes, 6, 7, 8 week old babies. No. That's not what's happening. Many are around the 20 week mark, which is when you happen to get your anatomy scan.
Yeah.
Yeah. But yeah, right now, to my knowledge, there aren't a ton of good alternatives. I've heard of these things called like organoids, which are being developed,
what did you say? Can you say that word again?
Organoids, which I guess is like an organ on a chip, is my understanding of how they're doing it, but you still have to get the cell lines from somewhere.
Yeah.
And I know there's been some research of taking cells from like menstrual blood or other parts of the body and attempting to make them pluripotent or act like fetal cell lines. But then you're also then significantly altering how that cell was designed to work.
Why would they use menstrual blood instead of just like blood? Like somebody giving blood. I don't know. That just flagged me as strange.
I guess in certain cases, I would have to look into the studies, but there was something specific about menstrual blood versus maybe because it came from the uterus.
Okay. That's
I don't know. I'd have to look it up. That's one thing I'm not afraid to say is the words I don't know.
Good, because I feel like we just had this conversation. Maybe it was it was a article I wrote a while back. Like people have to be able to say I don't know, and I think I did talk about it on the podcast. But like there's so much going on in the world right now, and everybody just like absolutely knows for sure what's going on. I'm like, it's just not true.
No.
Okay,
so I don't know. I will proudly say I don't know why specifically that. I can't possibly read all the studies. But I do remember reading one about specifically menstrual blood and attempting to use it to replace fetal stem cells. And there was some success, but it's not They don't work as well. They don't replicate as much or as quickly and in the numbers that they need. And then it tends to have those genetic errors sooner.
Okay.
So, and then the other thing that you haven't brought up with these different cell lines in vaccines, and I'm not saying this is the sole cause, I would just like people to consider the thought, is if you get a vaccine, Rita, you and I are girls, we're going to do some basic biology here, and we have received a vaccine that has male DNA in it, is it possible that that is leading to some of the confusion in our young people?
The thought.
It's a thought. I'm not saying it is the sole cause. I am not saying it with 100% certainty. I'm saying I think that would be a really good study.
That's interesting. Yeah. Yeah.
Like, don't take my stuff out of context. Don't try and like, not that you would, Rita, but like, that's not what I'm saying. I'm saying, has that been studied? I don't think it has. But if you do a chart of the increase in vaccines and the increase in certain confusions, they line up.
Mm-hmm.
I'm not saying correlation equals causation.
Right.
But I think there's something there to study.
Yeah. I mean, I think that speaking of multi-causal, which you brought up earlier, I think that's probably something that is multi-causal. But yeah, there's so many things. There's so many things that we should be researching that we're not. And oh man, I don't know. That's frustrating to me. The amount of things.
There's no money in it.
Yeah. Yeah.
There's true. Honestly, if there's no money in it. And then the other thing that bothers me about the scientific community, and honestly, the first time, in my opinion, that the scientific community got it right, and at least initially, was during COVID. And what I mean by that is, if I run an experiment and I don't get answers or results that I expect, or I get negative results, I don't publish that. Which means someone in the next state over could have the same idea as me. And now we're all wasting our time doing experiments on the same things that don't work. But because we're not publishing negative data, how much further ahead could we be if we shared that negative data? Mm-hmm. And COVID was the first time initially, it didn't continue this way, that people were like, hey, I ran this experiment, this didn't work. Hey, I used this animal model and this did work. It was the first time that there was open sharing of data without this, I guess, without ego involved.
Mm-hmm.
And I applaud the scientific community for that. It went away pretty quick, don't get me wrong. But initially, I thought that was great.
Do you mean just with the virus in general and like what people were seeing with the virus?
With the virus in general.
Not the vaccine studies.
Not vaccine studies.
Okay.
I mean, like,
just making sure I was following.
With the virus in general, hey, and I'm going to make something up. Ferrets can get it, but guinea pigs can't. So no need to do this 50 times. Yeah. Let's look at something else. So I think in part of that, not to say that people couldn't replicate it to verify it. That's not what I'm saying. But
people were sharing their information and not just withholding and like moving on to the next thing so they could get ahead of someone else.
Right. Yeah. And it was done in an open access way, whereas a lot of scientific journals, you can maybe read the abstract, which is like that little paragraph that
you got to pay.
Consolidates, but then you have to pay. And some of them are like $200 for an article. The average person's not going to pay that. That's insane.
Yeah, that's true. That's true. Like there are articles that I will want and I will dig and dig and dig. And sometimes you can find a free one somewhere.
Yep.
but it takes a while. Yeah. And sometimes, all you can get is abstract, which is better than nothing. But it's not the meat. If the purity and quality of the supplements you take and protein powders you use is important to you, you need to check out Equip Foods. You can go to equipfoods.com and check out their line of products and use the code RITA15 to save 15% on your entire order. Equip Foods is creating a world-class brand of real food supplement and food products that are simple, clean, high quality, delicious, tested for purity, and transparent. They utilize trusted marketing partners, and they set a standard for all other brands to aspire to. Their goal is to create new standards in a dirty industry that forces all other participants to level up while encouraging a holistic approach to health for people who want to improve. My favorite product of theirs is the Prime Protein, the unflavored version without stevia. They also have great flavors if stevia doesn't bother you. And they have liver capsules. They have tons of other products, but I prefer and really love their protein powder over any other brand. So go to equipfoods.com/Rita15 or equipfoods.com and use the code Rita15 to save 15% on your entire order. One more question I have for you. Actually, two. Outside of being pro-life, are there any other reasons people should be concerned with fetal cell lines? I think we talked about like the cancer aspect a little bit. Is there anything else you have? And if not, we can just move on from that one.
It's the cancer aspect. It's specifically, there has not, to my knowledge, been studies of what happens when you have another person's DNA or multiple people's DNA in your body. What does that do to yours? Because if you think of an organ donation, you have to be on anti-rejection meds because of that other person's DNA. Is that potentially a cause for some of the autoimmune issues that we're having and we're seeing an uptick in? I don't know, but I would love to see that study done.
Yeah, well, that kind of brings me to like, we give blood transfusions in the ICU, all the time. And so you're getting that directly. But if people get, a number of blood transfusions, they have like antibodies develop and things. And so that is a really good question because it isn't small doses probably. And people might say, oh, it's not very much compared to like getting an organ or getting a blood transfusion.
And
but it is
fair.
Interesting over time to think about that. And, you're getting this at a very young age when you're small. I don't know. So yeah, that is interesting to think about. And then the last question on that I actually kind of forgot about, but when you talk about medications and the use of fetal cell lines or embryonic cell lines in the development of medications, would you say that it's hypocritical for someone to say, I am not getting a vaccine because of a fetal cell line being used, but I will take this medication? And I know like we can't like make a claim on somebody else's conviction, but I'm just saying, is it one and the same? And so if you're saying you can't do one, but you can do the other, is that?
So certain medications, and I would have to look into the exact year, I don't know it off the top of my head, of when fetal cell line research became really prevalent. Many medications were researched before fetal cells existed or were super common use in labs. That, let's say, I feel like Zantac is one of them. I could be wrong, but let's say Zantac was made before fetal cell lines were readily used. Zantac was then later on researched with fetal cell lines, but it wasn't developed with. And so that's one caveat that you need to decide for yourself. It is my understanding, and from what I've seen personally working in a lab, many, many drugs are researched with fetal cell lines. The problem is they don't have to disclose that to you. There's not necessarily a paper that says, okay, we looked at these 5 drugs on these 6 fetal cell lines because that's considered proprietary information. So then it becomes, well, I know the likelihood it probably is, but I can't prove it. But if I don't take this medication, could I legitimately die? Or is this a I'm doing this because I want to lose weight or look pretty. I think those are two also very different conversations.
Yeah, absolutely. Absolutely.
And because we're not given all of that information, I don't know that anyone can make a truly informed decision.
Yeah. Yep. Okay, which brings me to we're lacking information in a lot of things going on in the world. It's really hard to get good information these days. And I feel like everybody's in pursuit of truth on all of these worldly things. And I mean, it's really hard out there because most of us just have the internet that's on our phone at our disposal, and we're researching just like everyone else, but we don't have the true ins and outs of everything. So what would you say that you think, like, we're just going world at large right now, like not just fetal cell lines, embryonic cell lines, vaccines, all this stuff, just like anything going on in the world. Like, as somebody who's part of the scientific community that very much uses like logical thinking patterns, like we talked about earlier, taking emotion out of it to get to the root of things. Like, I find when I'm watching people, like there's so much like jumping from camp to camp, and people are kind of like, I trust the government. And then they like wake up and they're like, everything is a conspiracy. And it's like, there's no like actual like thought pattern.
Correct.
It's like they're equating critical thinking with like jumping from I implicitly trust this thing to implicitly trusting another thing. And I'm just like, what are you seeing as the missing link there? Like, I'm seeing like logical thinking, asking questions without like coming up with answers immediately, you know, like being able to say, I don't know, all of those things.
I think both sides are guilty of groupthink. And I saw a really great analogy. Have you ever seen a very large group of sheep being herded by two dogs?
Yeah, I actually have.
Okay. So for people who haven't, you can have hundreds of sheep, two dogs, and they don't really do much, the two dogs, but the sheep eventually just start with inertia and momentum to move the direction that they want. But the dogs just kind of wiggling a little bit. I feel like that is what kind of happens in the sense of like, we'll take the virus example that you asked me about earlier. Either viruses are real or viruses aren't real. And there's no nuance. There's no conversation. People are using different definitions, and because you're using group A is using one definition and group B is using the other definition, you know, that creates a whole host of problems, and people lack nuance. And in my opinion, if you go from the government is always trusted to the government can never be trusted, well, I feel like you're leaving out this third option of two truths and a lie. Meaning, how do you know, using the virus example, the government didn't start this viruses aren't real thing? Like, how do you know that's not the psyop?
Totally.
Right? Like, how do you know? It happened during COVID, and it made you question other things. But then the other thing it did too, if you think about this, is the people who had legitimate concerns about vaccines were then seen as crazy because, oh, well, you're just a virus denier. This happened in the 50s and 60s when people were against putting fluoride in water. There was a claim that became very popular that this was all just being done by the communists. So the very real dangers of fluoride in water became synonymous with the conspiracy theory that it's a communist plot, which wasn't true. And now everyone has fluoride in their water. So how do you know that this alternative anti-government theory that you're perpetuating wasn't started by the government to delegitimize the actual concerns?
Oh, yeah. Oh, my gosh. We've talked about this on the podcast before. It's just that, like, I can't, this is kind of circular reasoning possibly, but I'm like, what if the people that are claiming everything's a psyop are like actually perpetuating the psychological operation themselves? Like they are the psychological operation. You know what I mean?
There's a term for that
I'm
in
just
the
like,
government. There's a term for that in the government. They call them useful idiots.
yeah, well,
Literally, that's what the government calls them. Because you then can't parse out the true issues without looking like you're crazy.
Yeah. Yeah.
If you think about what they did with the COVID vaccines, it was kind of brilliant because it became this, well, I don't think the COVID vaccine is safe because it's not really a vaccine, but all the other ones are. You heard that line, right?
Mm-hmm. Yeah, like people who were opposed to that vaccine specifically, or all people opposed to all vaccines were then saying, well, it's not really a vaccine. And like, why are you even calling it a vaccine? It's a biological, what were they saying? Some like biological engineered something. I don't know. But anyway.
Because it was mRNA, it was different.
Yeah,
It was,
yeah.
And they weren't exactly wrong, but it then negated all of the concerns about other vaccines.
Yes.
You can't convince me that the government didn't start that, because that's brilliant. That is some brilliant PR marketing right there.
Well, honestly, some of this stuff, like maybe the government did start, but also I just think people are so confused right now. They're so confused. Yeah. And, you know, I used to consider myself kind of a conspiracy theorist because back when it was like really interesting to look stuff up on the internet. Like, okay, we talked about a little bit in DMs about geoengineering stuff, and we don't need to get into that because we're kind of going long now, but we're kind of on the same page about this. And I'm just like, yes, geoengineering is real. I can remember in I think it was 2013. I have no idea. I cannot remember dates for the life of me, but I can remember this day. I was like, this is weird. I remember his name is Michio Kaku. I also remember that. Can't remember names, but he has a weird enough name, or not weird. I mean, it's not weird, but it's weird to me because I'm like a Midwestern white girl. But anyway, he's on TV talking about geoengineering. And I'm like, okay, this stuff is provable that it's happening, but like when people go crazy talking about like every single thing they see in the sky is definitely geoengineering. I'm like, no, like, anyway. So I'm looking all this stuff up, and this was like interesting to me back in the day, learning about Agenda 21, learning about geoengineering, all of this stuff, because it was before the internet was completely saturated. And people who were like researching and putting things out online were genuinely interested in this and like really getting some information out there. Now it's so saturated, and it's like cool to be a conspiracy theorist where it wasn't in the past. Like it wasn't a badge of honor. It was like a slur in the past. Now it's like a badge of honor. And there's so much on the internet about it, about every issue that could be considered a conspiracy. It's just like not even information. It's just like repetitive, like, you know what I'm saying?
No, I do. And I think so. Do you mind if I quote the Bible for a second?
No, we do that on the podcast all the time. So
Proverbs,
it's rare an episode without it. So
Proverbs 25:2 says, "It is the glory of God to conceal a matter, but the glory of kings to search out a matter." So based on this Bible verse, yes, we are supposed to seek truth, but that doesn't mean we're always going to get answers. It doesn't mean we're always going to be right, because his ways are higher than our ways.
Mm-hmm.
And if we go down this, I have to know the truth. I am the arbiter of truth. Only I know the truth. If you don't agree with me, you're wrong, you're crazy, you're a conspiracy theorist, you're uninformed. Insert whatever you want here. You're becoming God. You don't know. Nobody knows it all except God.
Yep.
So don't try and be the arbiter of truth, because you're not. No one is.
Yeah.
You can have ideas, but be willing to admit when you're wrong. I was willing to admit, I literally went from thinking Jenny McCarthy was crazy and being completely pro-vax to being humbled and reading an insert and going, oh no, I was really wrong. Mm-hmm. I have a lot of student debt and I'm really wrong. That's terrifying. But be humble. Be humble enough to say, I don't know. Be humble enough to say, hey, I didn't know that. Tell me more. Be curious, because otherwise you're just being indoctrinated, just in a different way.
Yeah, that's so good. That is so good. And I feel like, we went from one thing to another possibly, but it's a good thing to bring up right now because we're talking about, the fetal cell lines, the embryonic cell lines, all of these things that, yes, they're thrown around a bit on the internet, but rarely do we go deep enough to really learn about it. And we need to be able to have these conversations in a way that helps us make better decisions.
Yeah.
And I don't know, I just feel like we're skipping some of the steps when we have conversations on the internet, some of the big steps that allow us to really get information. Yeah.
Everyone wants sound bites. How long, if you're scrolling, if the first 3 to 5 seconds don't catch you in a reel, do you just scroll?
Mm-hmm.
I've been guilty of that.
Oh, yeah.
So like this art of debate and sitting down and having a conversation with someone and truly hearing to understand, not hearing to respond, is lost. And people will honestly say things behind a computer screen or a keyboard that they would not say to your face.
Yeah.
And I think that's part of the problem too.
Yeah, for sure. For sure. It's a big part of the problem. Yeah, for sure. So, all right. Well, thank you so much for coming on and explaining these things to us today. I know it's maybe like a more concrete episode. A lot of times we're like up here just talking about ideas, and this is a little more concrete, just like this is what's happening. This is what you need to know. But I think this helps parents kind of make decisions and just humans in general make decisions for themselves in the medical world. And maybe you gave some good websites to know where to go to do some research more ourselves on these things. So I really appreciate it. If you want to be found on the internet, I'm not sure if you do, but if you want to be found, you can let people know where to find you now.
Periodically, I will turn my profile on private just because people get weird. Currently, it's public, but is ONE thumb EL, one thumb LEL. And that's because I legitimately have one thumb. So that is how the name came about. If you're respectful, I've responded to various people in my DMs. I have no problem having curiosity conversations, respectful curiosity conversations. I have no problem with that.
Love that. All right. Well, guys, thank you so much for listening to this episode. Thank you, Ellie, for coming on with me. If you want to find me outside the podcast, you can find me at RitaRogersCo.com, Rita Rogers Co on Instagram, or Boom Clap Podcast on Instagram. Thanks for listening.